कैंसर को लेकर हम सबके पास एक ही सवाल है, पीएसए स्कोर हाई है तो क्या कैंसर है? PSA or the prostate-specific antigen is often associated with the prostate cancer, but it is not the whole story. Hello friends, I am Dr. Swapnil Tople. I am urologist and andrologist practicing in Mumbai. So let us understand the PSA. PSA is a protein produced by both normal and cancerous cells both in the prostate gland. It is found in small quantities in the blood of men with healthy prostate also, and high in males with the prostate cancer. Or there can be other conditions of the prostate which can cause increased PSA levels. So what is the natural range of PSA? So normally the PSA level varies with the age. For the men under 50, the level can be less than 2.5 nanogram per ml. For 50 to 90, it can be less than 3.5 nanogram per ml. And subsequently for men in the age group of 60 to 69, less than 4.5 nanogram per ml is a normal range. So what are the causes of high PSA levels? What are they? One is benign prostatic enlargement. So larger size of the prostate glands can cause higher levels of serum PSA. Secondly, the prostatitis, that is the inflammation or infection of the prostate. Thirdly, the urinary tract infection can even lead to high PSA levels temporarily. Next could be the recent ejaculation. So that also can lead to temporary rise in the PSA level. So other than that, medical procedures like recent catheterization, endoscopic procedures can lead to temporary rise of the PSA level. So PSA लेवल जो रेज्ड है उसको स्क्रीनिंग या फिर डायग्नोज कैसे किया जाता है? PSA स्क्रीनिंग इन्वॉल्व करता है ब्लड टेस्ट को. सो सीरम PSA लेवल इज अ ब्लड टेस्ट दैट इफ दैट इज इंक्रीज्ड it will prompt for the further investigation to confirm the diagnosis of cancer. So additional tests would be required to diagnose the prostatic cancer even though PSA is high. So these tests could be CT scan, MRI or biopsy. If PSA is elevated, doctor will first recommend you digital rectal examination. This is a first step to check the consistency of the prostate. If the prostate has got affected by the prostate gland would be little hard on the digital rectal examination. Next would be the MRI or ultrasound to visualize the prostate in 3 dimensions. And the next would be the prostate biopsy. Taking a small tissue of sample and checking it for the histopathological examination will confirm the diagnosis of prostate cancer. So what is the importance of monitoring PSA on regular basis? So if you monitor your PSA after the age of 50 years on a yearly basis would determine the chances of cancer in body. So even if the levels are not exceedingly high, that would keep the PSA in check. So treatment options for the elevated PSA. Treatment depends on the underlying cause. That is, so benign prostatic enlargement, your urologist can suggest you medication, and if even in extreme cases, surgery can be recommended. In case of prostatitis, that is the inflammation of prostate, some anti-inflammatory medication and the antibiotics can be given. If it is the prostatic cancer, so various options are available according to the stage of the cancer. It can be surgery, it can be radiation, or it can be hormonal therapy. Or in a patient who are very old age, the active surveillance also as an option. So high PSA levels do not necessarily mean cancer. So, and understanding the various causes of elevated PSA and working closely with healthcare provider can ensure proper diagnosis and treatment. Thank you.